Hello and welcome to this special show on Rajya Sabha Television, wherein we bring you all the aspects of India's fight against COVID-19, specifically the technological interventions, also the various tests which have been developed and drugs being developed along with vaccines also. Today we're going to talk about one such test which has been indigenously developed by National Institute of Virology, Pune, and that is known as IgG Elisa Antibody test, also named as KAVACH Elisa. So let me first introduce the guests with us, and we have Dr. Priya Ibrahim. He's the Director of National Institute of Virology, Pune. We also have with us Dr. Manoj Murhekar. He is the Director of National Institute of Epidemiology in Chennai. And we also are joined by Dr. Suresh Kumar. He's the Director of LNJP Hospital in Delhi and also the Nodal Officer for COVID-19 cases. So let me begin the show, and let me begin with you, Dr. Ibrahim. Let's try and make our viewers understand what exactly is IgG Elisa antibody test, and how did you and your team develop this?
Okay, I'll take the latter part of your question. How did we develop it? The first challenge for the Institute was to be able to grow the virus. And we achieved that in early March. And once we were able to grow the virus, and then this decision was made to make an indigenous IgG antibody detection ELISA, we went about first, if you have to work with the virus and hand it over to industry to make more of the same, we had to inactivate the virus. So we gamma irradiated the virus. And then we had to actually check it against individuals who had been definitely exposed to the COVID virus. And we checked their antibody against this virus antigen. And that's how the IgG detection ELISA came to be. IgG antibody develops typically after 10 to 14 days. So we used a panel of anti-sera from individuals who were 10 to 14 days after the onset of their, after having been detected to have this virus infection.
Okay. And how much time did it take for your team to go ahead and develop this? Because the way we read it, it was almost a month's, time period which you guys took to go ahead and come up with this test.
Well, actually, it came up much faster than that. But the longer time was to actually standardize growing up the virus in artificial cell cultures. And then, of course, standardizing the assay. This particular assay came together even less than 1 month.
Okay. And how do you believe, Dr. Ibrahim, this test will be useful in our fight against COVID-19? Because there are other tests as well. There is a rapid antibody test. There is a RT-PCR test as well. There is a Feluda test kit, which was developed earlier, just a few weeks ago. So how would this test add on to our capabilities?
Well, an ELISA-based platform is always preferable compared to the rapid antibody-based, the lateral flow technique, card devices. So this can never be compared in parallel with the RT-PCR assay, because the RT-PCR detects current presence of virus. This detects antibody to the virus. So there's a distinction there. So its use would be actually in sero surveys, in doing sero-epidemiological studies to find out who all have been exposed in our population, number one. Number two, more long-term study that we would like to undertake is, as and when vaccines come to the forefront, we would like to see in a vaccinated individual, how would this antibody ELISA work? In which case, that would be a good assay to screen people to see after vaccination, have they developed antibody.
Okay, so it will be a long-term use as well as far as this particular test is concerned. Let me bring Dr. Manoj Murhekar here on this aspect. Dr. Manoj, your views on this particular test, that is ELISA antibody test kit, which has been developed, and its utility and the features as well.
Yeah, as Dr. Abraham mentioned, we have two tests for COVID. First is a molecular test, which are used for diagnosis. And the second test is antibody-based test, which basically tells whether the person was exposed to the virus sometime back. So this antibody test tells us whether the person was exposed or not. and basically to know the seroprevalence of infection in the population. So in several countries, in fact, have conducted surveys to find out what percentage of their population was exposed to this virus. And this includes USA, France, Germany, and Sweden. So several countries have completed these studies, and then the infection rate in their population ranges as low as 0.5% to as high as about 15 to 20%. So for the first use of this antibody test could be to find out what is the extent of infection in the population. So because what currently we are doing is through the molecular test, we are finding out how many individuals are positive for the virus. But there are a lot of asymptomatic individuals, and there are a lot of individuals who are not tested because our testing strategy doesn't permit to test everybody. So that could be taken care by the antibody test. So, and second use of these, as Dr. Abram mentioned, could be in studies where we are looking for vaccine. So one could select a population which was not exposed to the virus for vaccination, and also see the response to the vaccine.
Okay, Dr. Suresh, from a clinical point of view, since you are there, as the nodal officer for COVID-19 cases in LNJP hospital, and handling the cases directly, these sort of developments do give a fillip.
Sure. First of all, I must congratulate Madam Ibrahim for a wonderful work, hard work which they did in the National Institute of Virology, Pune. It's a remarkable job which they have come out with the IgG Elisa test. This is very useful test for screening and for community surveillance. Already ICMR is doing a lot of testing in the districts. There is one study for SARI and another study for this infectivity in the larger population. So this new technology, new test which the madam has developed in the record time will be very useful in the periphery, in the districts, and in the community purpose. Because once we know the antibody detection in the people, that how much exposure they have. On the other hand, we have this hospital, Maulana Azad Associated Medical College, have the highest number of the patient in the country. Right now, we have more than 600 active positive patient of COVID getting treatment. And because it's a COVID hospital, all patients of Delhi, they are referred to us. They are already tested by RT-PCR technology. So they are the confirmed cases. On the other hand, what Madam is talking about, the community, the patients who are relatively asymptomatic, they are not having active disease, they are not having fever, they are not having any SARI-like illness. So in that population, we want to know whether patient have some subclinical infection or not, whether the population is exposed to the virus or not. So for that purpose, for planning, for surveillance, for detection of the antibody, and for vaccination, suppose patient is unexposed, then this test is very useful. And if patient have antibody already in their sera or in their blood sample, we come to know that this is the level of infection in the community. So this is very good for community surveillance for all the districts of the country. We have done the wonderful job. Our Prime Minister and all political leadership has done the remarkable job in controlling this COVID infection so far. So far, we are doing much better than our other Asian countries and other European countries. We are much ahead in controlling the virus. But now, as you know, that we are in the phase 4 and already this lockdown, there are many issues where the large number of population is moving from point A to point B. So, and we want to know the areas. So we can have this test very useful in the community level.
Okay. Dr. Manoj, would you agree there to the point which Dr. Suresh is making here, and as Dr. Abraham was also earlier pointing out, that more than the diagnostic part, this test will be very, very useful in the surveillance part here, something which will be the focus area starting from here onwards.
Yeah, exactly. So there are two. From ICMR's perspective, I can say the two things that we are doing. The first is we have launched a nationwide study 2 days back to know the extent of infection, to know the seroprevalence. So this survey is going on in 60 districts in the country to find out what is the level of infection in different districts. And the second important use, this is being done in collaboration, in partnership with the ministry, is for surveillance. So basically, the different groups, such as pregnant women, healthcare workers, as well as non-influenza like in illness patients who are attending hospitals in districts, they will be periodically monitored for the prevalence of SARS-CoV infection. So, and for that, for monitoring this infection, we'll be using the IgG test that has been developed by NIV Pune. So these are the two primary uses. One is sero survey that is currently ongoing, and second thing is a long-term activity, that is a surveillance, wherein in each health facility, in each hospital in the district, in the district hospital, basically, a group of people will be, the blood samples will be collected periodically and will be tested for IgG antibodies to monitor the infection.
Okay, Dr. Ibrahim, I would like to bring you in here to try and understand a bit more about the ELISA test and how it works. And specifically, how does ELISA-based antigen works?
This is actually an antibody detection assay. So this is done on a plate that has 96 individual wells. The antigen that we prepared from the virus that we grew up has been coated onto the plate, individual wells of the plate. You add patient serum, incubate it, and then you have another detector antibody, and there's an enzyme substrate chemistry. I won't get too technical there. Mm-hmm. You use that, and if you get a color reaction in a particular well, it would suggest that there's presence of IgG antibody in that well. Of course, we have some parameters by which we would say a certain amount of color, which is measured by an ELISA reader, which is really like a spectrophotometer, a certain amount of color would qualify to be truly positive. So we have more objective methods, not little color, not medium color, but a certain amount of color which is actually calculated, by which we say this amount of color suggests presence of IgG antibody.
Okay, and so it can test multiple samples as well, as you're pointing out. There are almost 96 portions on the plate there.
That's true. So we can we usually have some wells that we reserve for controls to know that your assay is working well, and then as much as 92 different samples can be tested in the individual wells in one plate.
And how much time does that take?
That would take approximately about 2.5 hours.
Okay, so clearly in terms of time also there's an advantage out there, and multiple number of tests can also be, samples can also be tested. How about, going ahead, and now that we will need this particular, test kits on a large scale. So I understand the commercial part has been handed over to Cadila. So in how much time can we expect that to begin so that, these tests are available?
So actually, we've handed over to them. They have been in touch with the DCGI. I think the DCGI would like them to. They made one batch. The DCGI would like them to make 2 more batches of this ELISA, which will be validated by us and some external laboratories. So when we have 3 batches validated with successful results, then they're ready to go. They will get their license for use in the country.
Okay, so 2 more batches rather to be produced, and then perhaps that should take a few weeks, if not more than that. Dr. Suresh, coming back to you on the ways and means which are have right now with us in terms of our fight against COVID-19, different tests which all of you are mentioning as well. The focus, as Dr. Manoj was also saying, is right now, or should be again right now, on trying and identifying as to where are the demographically, where are the problem areas located, and try and identify perhaps where the exposure is more, so that all our efforts can be, pinpointed in those places.
You are right, Mr. Dahiya, that we want to know where are the hotspots, where we have the large number of population affected. And these tests can tell us that these numbers are positive. But we need to know very clearly that there is some limitations of these tests. One is those that if you have some patient and you have sometime indeterminate report, or sometimes you need to know the limitation of the test, ability to test the true positive and true negative. That madam will tell us on more detail that sometimes we can pick up the test. So there is some chances that patient have the sensitivity and specificity of these tests is very crucial. So we have the large number of kits, and the sensitivity and specificity, that ability of the kits to identify those who are truly positive, and on the other hand we have to exclude those who are truly negative. So that is very important. And second thing, when you go to the areas where you have the large number of the patients, and you have the hotspots, and you have the utility of these tests is more for the healthy population rather than those who are actually having symptoms. So this is the one area where madam will tell us more about the sensitivity and specificity of these tests.
Okay, Dr. Abraham, sensitivity and specificity.
Yes. So to even arrive at that, our comparisons were against those people whose blood samples were taken. We tested serum and plasma. We checked it out for efficacy for both. So the positive samples were those from those who were recovering from known COVID infection, SARS coronavirus. The negatives were those who were tested for coronavirus. They were negative for the virus when they presented with some influenza-like illness or cold and cough, and also people with unrelated respiratory infections, be it influenza or adenovirus or respiratory virus, syncytial virus, other unrelated viruses. So we used this panel and we tested the panel of sera, and our sensitivity is 92% and specificity is almost 98%, 97.7%, which is as good as 98%.
Okay, so that could be counted as very good in terms of both the parameters out there. Dr. Manoj, concluding comments from you in terms of, as I was asking Dr. Suresh as well, these kind of tools which we, with the passage of time develop, and specifically indigenously develop, they do give us a lot more strength in fighting this particular pandemic, because it then opens new avenues for us to try and find more about the virus, more about the people who are exposed, and then focus all our attention accordingly.
Absolutely, I fully agree with you. And the kind of sensitivity and specificity that Dr. Abraham has mentioned is really good. It can be used for seroepidemiological studies. There is another use which at least some countries were contemplating, is whether the positivity to IgG antibodies could be used as immunity passport. So that, but again, I would like to caution that there is not enough evidence to say that a person who is having IgG antibodies, whether he or she is immune to reinfection. But I hope this data will come in coming days, and then that if then there is evidence that IgG antibodies are in fact protective in nature, this person will not get a reinfection. So that could, in that case, this test can also be used to give immunity passports. But currently the use is to know whether a person was exposed to the virus, to the infection or not.
Okay, definitely. That would be a very, very significant aspect which pointed out Dr. Manoj. Once more information, more data is there, whether or not it can be used as that immunity passport. But we'll have to wait for that. Final comment from you, Dr. Abraham, on the indigenous aspect, because that is a very significant point here. We have been successful in the past few weeks to indigenously develop several things. It's not only about testing kits, be it ventilators, testing kits, and PPE kits, and several other things as well. Something which was not there earlier, before we faced this pandemic. We were dependent on imports. Dr. Abraham?
Yeah, so yes, I think necessity is the mother of invention. And when we need to find our own solutions in our country, we just have to get on with it. So we have been lucky. And before we close the show, I want to acknowledge two of my lead scientists, Dr. Gajanan Sapkal and Dr. Pragya Yadav, and their respective teams, who work tirelessly to make this possible. So, I mean, they're not appearing here on the show, so I feel duty bound to actually acknowledge them for their efforts.
Definitely. Please convey our appreciation as well, not only mine, but the entire Rajya Sabha TV team and our viewers as well, to Dr. Kajan and Dr. Priya there as well. Concluding comments from you, Dr. Suresh, before we bring the show to an end.
Our scientists are doing wonderful job, and similarly our clinicians, our doctors, young doctors, nurses, they are doing extraordinary work. They are doing round the clock service to the society, and this new test, which I wish all the success, the great work done by the National Institute of Pune, and we look forward that country is now doing a tremendous success in the science and technology and in the field of medical science. And we need more such research in this area, because this disease is new and new challenges are there. We need more and more research to develop a vaccine to fight this disease. And we are already doing a lot hard work. All the congratulations to all the virologists and all the clinicians. We look forward for this wonderful work. Thank you very much.
Definitely. Thank you so much, Dr. Suresh out there, Dr. Priya and Dr. Manoj, not only for the views which you have shared with us right now, but for the work which is being done by people like you, doctors, scientists, researchers as well, your team, those who are not there on the show, those who are not seen on television, those who are not written about in newspapers as well, but are working tirelessly in the background, in the backdrop, to find solutions to all the challenges which all of us as a society, as a country are facing right now due to this pandemic. And as everybody is hopeful, we will emerge definitely victorious. But for that, all of us will have to do our part. And in between you and me, viewers, the best we can do is stay safe, follow all the guidelines, specifically with respect to social distancing norms, and we will emerge victorious in this war against COVID-19 pandemic. Thank you so much once again, and keep watching Rajya Sabha Television.